Hi, I'm Dr. Larry Malerba, and welcome back to the ATH Therapeutics series. Today I'll be talking about urinary tract infections in women. The information discussed here is best suited for treating acute urinary tract conditions. Although the same remedies may be helpful for chronic UTI problems, treatment of a chronic UTI is a more complex challenge that requires taking into account not just the localized urinary tract symptoms, but the entire symptom picture of the individual in question. So, with that said, let's get started. Okay, when treating a UTI, the smallest of details can be very important. Unfortunately, since conventional one-size-fits-all medicine programs us to lump everything into one big category called UTI, it doesn't encourage patients to pay close attention to the details of their own symptoms. So it's up to homeopathic practitioners to help their patients to tune into those small differentiating clues that can guide them to the correct remedy. And we do this by asking the following questions: what, where, when, and why. By what, I mean, what is the problem? And when a patient responds, I have a UTI, I say, no, that's your diagnosis. I want to know what it is that made you seek help. And that's when she says, for example, oh, I'm having a constant urge to urinate. Or, oh, it burns so bad when I urinate that I can't stand it. Or, I'm having trouble urinating. I can only pass very small amounts at a time. Or, I cramp when I try to urinate, and so on. The possibilities are quite varied indeed. Okay, so once we've established what the problem is, the next question becomes where is the problem? And to illustrate this, I'm going to use this diagram of the anatomy of the female urinary tract. Starting up here, we have the kidneys, which are connected to the bladder by the ureters. Here we have the bladder, where the urine is held, and then the bladder connects to the urethra, which is the short tube through which urine passes during urination. A woman's urethra is a lot shorter than a man's urethra. This part of the bladder here is called the neck of the bladder. Muscles in the neck of the bladder keep urine in and prevent urine from passing. When the bladder relaxes, urine passes along the length of the urethra until it reaches the opening, which is called the meatus here. So in review, we have the urethral meatus, the urethra, the neck of the bladder itself, the ureters, and the kidneys. Now, armed with this information, we can begin to pinpoint the nature of the problem. So when someone says, I cramp when I urinate, we can try to determine if the cramp is at the meatus, or in the bladder, or in a kidney, for example. We may need to educate our patients about urinary tract anatomy in order to help them tell us where the cramping is occurring. When a patient says, I'm having sharp pains, we can ask if that pain is at the urethral opening or the meatus, along the urethra, in the bladder, or elsewhere. Now, after we've established what and where the problem is, the next question we need to ask is, when does this problem occur? Or another way to ask the same question is, when is it at its worst? This is how we ask about some of the potential modalities. When the patient answers, it bothers me when I urinate, we ask them to be more specific as possible. To help them answer this question, it's important to explain that it's possible, for example, to feel burning just before urinating, at the start of urinating, during urination, toward the end of urination, or after urinating. It's also possible to have a symptom like burning only when not urinating. Again, the tiniest details can help us solve the puzzle of a urinary tract infection. Patients may not always be so clear about this, but the more certain they can be about those details, the more we can rely upon those clues in our search for the right remedy. So when a patient says, "I think it burns when I begin to urinate," that may be potentially useful, but it's even more helpful when she says, "It's much worse when I begin to urinate." Okay, so once we know what, where, and when symptoms are happening, we need to inquire about why they are happening. Sometimes a patient's answer to this question can be very helpful, and sometimes it's not, but it's important to ask. Perhaps the problem developed after a strong emotional stressor, like anger or grief, or after a physical stressor, like being catheterized or undergoing a cystoscopy. It's quite common for women to report developing cystitis after having sex, or maybe it came on after a fever or after catching a cold. These kinds of clues can sometimes lead us directly to the remedy that's needed. Now, one additional factor to be aware of is the idea of common symptoms. A common symptom is a symptom that one can reasonably expect to see or to be present given the medical situation at hand. For example, if a person has a flu, it's pretty typical to expect him to complain of fever, chills, aches, and pains. The problem is that none of these symptoms are particularly helpful in determining the remedy that is needed. They're not helpful because they're too vague and nondescript. In other words, they are common symptoms. They're exactly what you would expect from a person with the flu. On the other hand, if our patient with the flu says that he has been having terrible chills at 1 a.m. for several nights in a row, now we have a much more specific and very valuable clue. It practically begs for a prescription of arsenicum. When we apply this concept of common symptoms to a urinary tract infection, we know that it is common to hear complaints such as, "I have to urinate frequently," or "It's painful when I urinate," or "I get an urge to urinate and have to run to the bathroom." So the key to successfully treating a UTI begins with weeding out the everyday common symptoms that don't help us. They don't help us because most people with UTIs have the very same symptoms. It's more important to discover the unique symptoms, the symptoms that differentiate one UTI from another UTI. In other words, we're more interested in the characteristic symptoms of the particular case at hand, because they are the symptoms that define the uniqueness of the individual case. All right, once we know the right questions to ask, and once we know how to identify the common symptoms of the case, only then are we really ready to study the symptom patterns of some of the more common urinary tract infection remedies. I say this because if you open any reference book that describes remedies for treating UTIs, those descriptions tend to blur together rather quickly. It's very easy to become confused because one remedy description starts to sound a lot like the next description. It's a real challenge trying to tell them apart. Okay, so I decided to break this discussion up into two parts because otherwise the video would have been too long to hold your attention. So in part B, I will be discussing specific UTI remedies. And I do my best to describe these remedies in such a way that it helps you to tell them apart. I try to highlight the uniqueness of each remedy picture so that you'll recognize it if and when you encounter it. Okay, thanks for watching. I always welcome your comments and questions. This homeopathic educational project would be nothing without the support of you, the viewer. So please tune in again to the next All Things Homeopathy episode, and may the vital force be with you.